All right, welcome to this afternoon's discussion, Night Watch discussion on the film The Night Listener. So, any particular character or scene you'd like to start off our discussion with? Observations.
I guess committed to
Pete?
he seems to have like a bizarre relationship. He always I thought that was
All right, so let's deep dive Gabe a little bit. Gabriel. Um, Other observations. Now, I think one of the things we would look at, start off step one, everything that you just observed and noted would be completely normal until it's not, right? So one of the questions that I would have, are there any details, are there any behaviors that you observe that would be outside of a culturally sanctioned norm? And when I say you, I mean collectively you. Yes, we got a yes. And actually, is there a scene that you could actually let us know of that would support that?
he woke up and he saw him. In my opinion, and he had to just watching him.
Mhm. Several observations that would support that idea. Next step, not all abnormal behaviors are disorders. To render a identified behavior as disordered, it must cause clinically significant distress or impairment in functioning. So, any scenes here that would allow us to say there's probably a mental disorder here that would explain the behavior, the abnormal behavior. So I think there's two. He is a radio talk show host and is writing a book. We could discuss and even debate whether or not the book ever gets written, but there might be something vocationally that uh, might be construed as a functional impairment. The other part of this, though, that I think is even lower hanging fruit, an area that we would need to inquire, is this former relationship. He just broke up, and I'm wondering if, and we heard a little bit of dialogue here. One of the reasons why they broke up is because he does sensationalize. Remember what post breakup, um, his ex asks him, "When did I first tell you I was positive?" And the recall and what he says is wrong. He says that worked for you because you built that story in your own mind. So yes, there does seem to be some impairment in interpersonal function. All right. Well, the next step, of course, is to determine what specific mental disorder does Gabe have, is the night listener about, and that's going to be the focus of the rest of our discussion today. Um, as we get there, what other scenes jumped out at you that you'd like to discuss? Mhm. All righty. So that's Donna. I still want to hang out with Dave, though. Gabe. But we could take a quick detour and talk a little bit about Donna as well. Observations.
I want to know like if she had any past, what her childhood was like. Is it alluded to happen?
Yeah. In the very end, just I think immediately previous to the scene you just described, there's a phone call, and Gabe asks Pete, "Did something happen to Donna when she was younger?" Right. So the psychiatrist, the therapist would absolutely want that information, need that information. I assume there is. We saw even a scene prior to that. There's a bedroom scene. There's a radiator with chains attached to it. So there's something there. In the very beginning of this movie, when Pete goes to Wisconsin and meets Donna for the first time, Donna says that her mother died when she was 2. And the words she uses to describe her dad are very curious. Something along the lines of, my dad did his best to raise me. Right then and there, there's more to learn, right? Again, a therapist, psychiatrist would pause and ask if there's more to share. So yeah, we're definitely going to go there. And let's say for purposes of our discussion, the answer is yes. There is a history of significant emotional, perhaps even physical, if not sexual trauma in Donna's history. What else about Donna?
A reaction that wasn't what for defensive.
And verbally abusive.
Yeah.
Yeah. So how would you describe Donna's affect in that scene? Maybe. Maybe. Yeah, I mean, remember, there are 5 domains of affect. There's the type of affect, there's the intensity, there's the range of that intensity, there's congruency or appropriateness, and then change pattern. Yes, and Donna's change pattern is absolutely labile. Yep. Again, perfectly normal. I can make anyone in here go from 0 to 100 in 2 seconds as well. However, if we see this to be recurrent and clinically significant, it might become the focus of clinical attention. If so, for sake of educational purposes, let's say yes. What is in your differential diagnosis here in terms of clinically significant mood lability? Which, by the way, has the same etiology as the one that we already investigated. So there's some consistency here. All you've done here is point out yet another aspect of this character that seems to be consistent with a history of early childhood trauma. We finished with Donna? Is there more?
I mean, they tend to. She was like, "Oh, this might be kind of like a munch that
Yep. Yeah. Let's talk about this. This is Anna's character. And I love her dialogue because she says a lot, which is very consistent with what we might see in clinical practice when we ask a collateral what's going on and we get a lot of information that is so much beyond the slice of time that we know our patients. Unfortunately, sometimes that dialogue is overproductive and we have to really kind of grasp what we need to and know where to pull from because there's too much that's given. And unfortunately, a lot of it is incongruent itself. It's just not consistent. So let's try to tease out what Anna really was trying to tell us, right? Donna presents with us what appears to be blindness. If she saw a neurologist and an ophthalmologist and both collaborated on this case and said that there does not appear to be any physical cause for Donna's chief complaint, we could see how that particular character, fictional or otherwise, can actually be referred to a psychiatrist for psychiatric assessment and evaluation. I think the first thing the psychiatrist would consider is that there's a psychogenic illness. And I use that term to identify any illness for which the underlying organic or physical cause cannot be found. Whether correct or not is irrelevant. If the referral is telling you that they don't know what to do next, it's a psychogenic illness. Now, that doesn't mean that in 24 hours they could find the organic cause. So there's got to be some level of humility here. But for this particular day, at this particular moment, we say psychogenic because without that organic or physical component knowledgeable or available, the only thing we can do, the only thing we can address is the psychological. And that's where the psychiatrist comes in. Hopefully, it really starts with the empathetic non-psychiatrist general practitioner, but there's usually a referral that's made. When the psychiatrist first sees that patient in their initial office visit, they have to make sure they continue that empathetic dialogue. Okay. My role here is to primarily focus on the psychological aspect of your illness as your neurologist, general practitioner, other continues to investigate the organic etiology. So let's talk about why you're here today. We're going to call this a psychogenic illness only because right now, today anyway, psychological variables are deemed to be central in either the etiology or progression of your blindness. Make sense? At this point, the focus of my clinical attention, whether I actually state this directly to the patient or not, is irrelevant, but the focus of my clinical attention will be what? Other than safety. Safety is always first. But after I establish that the patient is safe, what is the one thing I'm going to look into right now in terms of the algorithm that we're building in our heads as to determine what ails Donna? What? Well, we established that, and that comes a little later. I want to know whether or not Donna is making a conscious effort to deceive me. Right? And the way I like stating this is there any observable evidence that Donna is making a conscious effort to deceive me? Because without the observable evidence, the answer is no. Now, if you put on a lie detector and it shows that she's lying, it doesn't matter. Without the evidence, the answer is always no. And by the way, we don't use a lie detector, so don't even think it. Right? The answer is always no until the evidence manifests. In the absence of such evidence, we have a two-part differential diagnosis. It could either be 1 or A or B. What are the two conditions now that come to the forefront of our differential diagnosis for Donna? Perfect, right? Somatic symptom disorder is a condition in which the individual presents with one or more somatic symptoms for which no underlying physical cause can be found. It's that simple. When that symptom is specific to voluntary motor or sensory function, we call it conversion. So conversion disorder is nothing more than a subtype of somatic symptom disorder. So blindness, what is our single best diagnosis? Conversion. Blindness is a sensory dysfunction. And if it's motor or sensory, we're going to call that somatic symptom deficit conversion disorder. Donna has conversion disorder. Now, let's say there's evidence in this movie to suggest that we caught her in a lie. This isn't. So in the hospital, maybe we walk into the room, we see her reading a novel. And as soon as we walk in that room, she hides the novel under her. And that gets documented in nursing notes. Right? I mean, we really have to be specific when we say that there's evidence. Things change now. Things have changed. Before we get into what that means clinically, reverting back to the movie, any scenes here that would suggest that, no, there's evidence? Kind of might have. kind of might have maybe. Can a blind Donna do that?
Like her vision, I guess, in that whole scene, those things stayed consistent.
This is the exact reason why diagnosing something like conversion versus other is so difficult for the healthcare professional. I mean, ever since you were very small and your mom, dad, and uncle were telling you you're going to be a doctor when you grow up, you've had it in your heart that you're helping people, right? Like arguably, not arguably, I'm going to get in trouble for saying that it is the most noble profession. It's very difficult to have these discussions that helping your patient means calling them out on their lie. So this is very difficult for healthcare practitioners. This is one of the more underdiagnosed and misdiagnosed conditions there is in the entire DSM for that reason. So that's why we keep it fictional, right? Because if we're going to offend someone, it may as well be Donna, because right at 401 today, she doesn't exist. Getting back to the original question, though, do you have evidence that she lied? I got a yes.
Well, this is one scene. Guess you could argue that maybe she heard it, but
Yeah. How 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 long after she makes that comment does the cab pull up?
maybe not.
Maybe not. And we really need discrete evidence. So let me first introduce the ending scene. Can Donna say? Okay. Now, that either means she's lying or she lied, or there was spontaneous remission. Unfortunately for us, in terms of our decision making, our medical decision making, conversion actually confers the most positive prognosis because there are cases that actually have spontaneous remission. However, the spontaneous remission is almost always due to the unconscious conflict having been resolved, right? So, Tiny Tim is limping around the Cratchit home. And the day that Bob Cratchit is made partner and they're no longer poor, he drops his cane and starts walking. Spontaneous remission of a conversion disorder upon resolution of the conflict. Is there any resolution of the conflict in this movie that would explain why Donna's blindness spontaneously resolved? I take that as a no. All right, so I don't know if that's quite enough evidence that I need to say, therefore she's lying, because again, we have to be very careful when we call our patients, call out our patients and being deceitful. Do you recall the very first time that he meets Donna, actually meets her in the same place? Where is it? Yeah. Yeah, no, in the diner. I'm in the diner scene. He looks under the table and it's a dog that she's talking about. And then he lifts his head up, and what happens next? Yeah. Now he's not making any noise there. I mean, he's actually very cautious not to make noise. And the way she turns her head isn't as if she heard something, heightened senses, and would turn. She actually turns very slowly. Again, I do take that as her having seen him, but I'm like 80% there. So definitely, we're gonna keep this at conversion disorder for now. However, for purposes of further teaching the differential diagnosis of these medically unexplained somatic or physical symptoms, let's say there is an unedited scene in this movie. Now we're going to splice in where she is in fact reading a novel. She's reading the Velveteen Rabbit children's book, and we see it. We see it, and therefore she sees it. Now what? We're not able to call this conversion disorder anymore. What is our two-part differential diagnosis now? Yeah. Right. So this is factitious disorder versus malingering. Right. She's intentionally feigning her illness. Now, the reason why the individual with factitious will misrepresent their symptoms is different from the reasons why someone with malingering would. Right. So what differentiates factitious disorder from malingering? Right. So if there's any evidence of an external incentive, we call it malingering. In the absence of any external incentive, the default is always factitious, right? There's something internal or unconscious that is motivating the behavior. And that's the breakdown. Is there any external incentive that is written into this script to suggest that this happens to be a story, Donna's story of malingering? You don't think she's doing it for the book? Yeah. So this might be malingering. Now that it's malingering, there's nothing for us to do because malingering is no longer published in the DSM. Right? Malingering is not considered to be a mental disorder, right? It's a crime, and it's going to be referred to local authorities and law enforcement, criminal justice, but not the medical field. So that's the way I would kind of step-by-step approach very complicated cases. But if you just stick to the 2 or 3 step algorithm, it does simplify things for you. And now what becomes a lot less simplified and much more complex is treatment, but a little bit beyond the scope of our discussion today. Any questions, anything further to discuss with regard to Donna? And I think we have the core etiology too. Again, early childhood trauma would result in all of the above here. Unfortunately, early childhood trauma does not differentiate conversion from factitious. Both are etiologies of both include that third variable, the common variable. Alrighty. Other characters you care to discuss? Do you think Pete exists? Not at all, right? All right. How do you then justify that in the beginning of this movie there are not one but 2 scenes in which you see Donna and Pete in the background? There's no right answer. I mean, it's your interpretation. Right? I'm asking. That's the one scene, and then I think there's another scene in the hospital, which follows that. Yeah. Yeah. I mean, if you take that as again, this all is up to the individual viewer. Your choice is going to be if you want to view this film through the first versus third person perspective. If you go with the third person perspective, that's incongruent. Pete's real. However, if you want to go first person and say, I'm seeing this through the eyes of blank, then this could be a product of their mind and you'd see it as real. So it's a viewer's choice here. What is interesting is that immediately following the second time we see these 2 characters in the same place, that's both Donna and Pete. The scene immediately following is the discussion between Gabe and his ex about whether or not the voice is the same one. And right when that conversation takes place, right when this whole idea that this might be factitious versus malingering, you never see those 2 characters in the same scene again. But I don't know if that was by chance or if the writer producer was actually trying to send us a message. But when we watched this last night for Fiddler, after seeing Donna and Pete together, and I think it's when she handed the phone over to him or took the phone from him to hang up abruptly, then she calls him immediately back. You never see the 2 again. From that point on, I actively watched the entire rest of the movie to see if those 2 characters were in the same scene again or not. Other observations about the film? But to get back to Gabe, everything's going on with Gabe. Further discussion.
the movie. Or with him. Glamour.
With regard to those two observations you made, bringing them together, what is the next question we would like to ask Gabe? Again, just to repeat, his need to tell a story. This is not unlike when we first meet a patient, and we're operating with a little quick 8.5 by 11 sheet of paper that we're taught in M1, M2, the checklist. And there's tangentiality, there's circumstantiality, the need to tell your story. That is most often completely normal until it's not. Let's say for purposes of this film discussion, it's not. That, taken along with his perfectionism, his need to be in control, the two together will result in your thinking of blank and therefore asking about blank. And? Well, no, I mean, saying, and then what do you want to ask him? And the generic question is going to be, why do you think you need to be in control? Why do you think you need to be in control? That's obviously the question in your mind. How will that actually be expressed to your patient so that they can provide an answer to guide you in the right direction? When in doubt, where are you going to go with this idea? As the patient sitting across from you in an office visit or therapy session? Always. Always. There's a reason why. So let's investigate why you feel the need to always be in control, why you need to be that perfectionist, and why is it that every time I ask you for the time of day or how you're doing, it's 15 minutes later before I can get the next word in edgewise? The over-dramatization, need to tell a story. And I'm thinking it's early childhood neglect. So something to consider here. We get a brief glimpse of his interaction with his dad. So that interaction does not soothe me in any way to think, oh, no, there's nothing there. So we'll just leave it there. Other thoughts about Gabe or final thoughts? Any other characters you'd like to discuss? All right, we'll leave it here. We'll log off.